Hello, my name is Wendy Williamson, Dr. Wendy Williamson. I reside here in Wichita, Kansas, and am the owner of Williamson Wellness Center here in town. My background includes an undergraduate degree in health and physical education, a master's degree in health science, and a PhD from Oklahoma State University in exercise science with emphasis on low back pain. I'm what they call a post-rehabilitation specialist, or perhaps a medical exercise specialist. In this regard, with Greg Kirk, I'm interacting with him, and he calls it fitness therapy. I believe it's many times is basically the same thing. In my work, I have advanced my degrees and certifications to the point that I am an advanced personal trainer. I have not only have written a chapter for the American Council on Exercise, been featured with an article in ACSM, PT on the Net. I've also traveled and spoken many times at conferences for club industry, as well as IRSA. I have been a fitness consultant and traveled and spoken and trained other personal trainers. Currently, I'm involved in training a lot of the YMCA trainers here locally. It's difficult for me to travel as much as I used to, but I am certainly continuing my training and education. I'm also working with physician assistants at the university and involved in a research study as well. My passion is helping others to do what I do and to take special care and need. What we're finding in this industry, in the fitness industry, is that we have people who are leaving physical therapy and are not ready for the real world. We're finding that they are not totally rehabilitated. They're left with exercises to do, which is fine, but many do not do that. So not only do I see people with low back pain, but I also see people who are recovering from perhaps spinal cord injuries, knee replacement, hip replacements, orthopedic problems, metabolism issues, neurological issues. A specialty of mine is also Parkinson's disease. And we are seeing so many great strides when we can identify muscle imbalances or taking people to another or higher level for fitness. I think the healthcare industry has served us well, but yet with the Obamacare, we're seeing that more providers in the medical community are getting to see patient and or clients, and it's gotten to the point that physical therapy reimbursement is being very limited, and we need to be prepared, we need to be ready, and we need to take these handoffs and be adequately educated to continue their care and still be involved in what I call the medical chain. And even though we may be called upon to go into homes, we may be called upon to serve in other needs that we never dreamt just because of third-party reimbursement limitations. This fitness therapy that Greg talks about is just absolutely critical. We are seeing it more and more with weekend warriors, with the baby boomers. It's necessary that we're prepared and that we're adequately trained. I think that it takes somebody special that wants to focus on these special populations that need the extra care. It takes diligence, it takes study, but the rewards are amazing, and if we position ourselves well, I think that it's going to continue to grow. Fitness therapy is not going to go away. In fact, the demand is going to be so great that those of us that are doing it now are going to be further along, because I highly anticipate in the next several years that it may be insurance covered. I know that's a big stretch for us, but I do believe that if those of us that are ready will maybe be able to receive insurance and payments for our services as the medical continuum continues, and that we are perhaps at the bottom of the chain, but we need to be positioned for that. I welcome you to the fitness therapy industry. I think it's there if we are willing to take it and willing to pursue it. So thank you for your time, and the best of luck to Greg. Thank you.